Hi, I'm Dr. Sangeeta Honnur, founder and director of Smile Elements Dental, Bellandur, Bangalore. There are certain times when erosion is very severe or the wear of the teeth is so severe that it has changed the shape and size of the teeth. Then there is total makeover of the smile that is needed. So when we are talking about only a smile makeover, we are talking of the teeth that are in the aesthetic area. We are talking of the 6 upper teeth and 6 bottom teeth probably, or extending to the premolars. But if we are seeing this erosion affect the whole mouth, then we are talking about a whole rehabilitation of the full mouth. But for a smile, which is in the front area or the anterior area, what we say, when we want to kind of work on if there's wear and tear that is so severe, we would see that as if the teeth are kind of flattened. So the shape has changed. That's when we kind of have to design the whole smile for a smile makeover. There are certain parameters or design parameters that we follow when we do the smile makeover. Like say if I can just list a few of them, it would be when we evaluate a patient, we have to see how much wear has happened. That is, if the height to the width ratio of the tooth, which has to be about 80 to 100, that is height being 100 and width being about 80 is what we see, that has to be maintained. And then we have to see if the wear is more on one side, that is the midline of the face of the smile is very important. So we take the midline into consideration. Midline that goes between the brows and to your nose to the middle of the two incisors is what is checked. And then we do see how the teeth are inclined. That makes up for a good smile. Teeth have to slightly incline towards the middle of the face. That is what we see, a mesial inclination. That has to be there for a smile to be good. So we kind of have that into consideration. And because the wear, if the line of the smile has to follow the line of the lower lip, what we say the smile curve, and if too much flattening has happened, then we have to take this smile curve into picture of how we are going to place crowns and work on them for the smile curve to be there. And then the other most common thing we see with wear is when a patient smiles with severe wear, you hardly see tooth structure because there is eroding of the tooth structure. So about 2 millimeters to 3 millimeters of teeth structure at least has to be visible. So you make a patient smile and we do record how much of the tooth structure is visible and what we want to get corrected. And then there are other issues such as the gums, and if wear of the teeth has happened, but if the patient has a very gummy smile, you must have seen some patients smile and you see a lot of gum. So 2 to 3 millimeters of gums has to be seen when a person smiles. Anything more is considered as a gummy smile. So we take that into consideration when you're planning a smile makeover. And the height of the gums is an important thing too. That is where the 2 central incisors end. Then the lateral incisors come a little lower. Then the canine teeth go up at the same level as the central incisors. So when we kind of give consideration to all this, that is when we can really plan a good smile. In addition to this, we also see the whole vertical dimension, what we say, that is the ratio from the nose to the chin, what is the amount of space that we have and how much is going to be the space where the teeth are going to be visible is another important structure. And the gum condition also. If the gum condition is not okay, the gums have gone up because of gum issues, then we start seeing triangular spaces between the teeth. So that has to be addressed as well when we are making crowns for a smile makeover. And the position and angulations of the 6 teeth, which are positioned where we see the triangle is the smallest between the 2 centrals. It increases as we go to the laterals, then slightly increases as we go to the canines. So this is one of the parameters we follow in the golden proportion of smile design. So once we address, depending on the erosion or where the patient has, all these things will be checked as a rule, and then new smile designed, and probably an habit breaking appliance, and training. After you do all the work, it's also very necessary for maintenance. So we usually end up making a night guard, or really explaining about dietary changes and water intake, and how to avoid foods that would cause further damage. So whatever treatment is done will last a lifetime. Modern dental techniques with expert dental artistry can really resolve these problems.